Hi everyone, Dr. Jesse Houghton here. Today I wanted to talk to you about what I look for when doing an endoscopy on a patient. Many of you may have had an endoscopy or a colonoscopy before. Sometimes we just refer to them as scopes. But you are likely not familiar with what your doctor is actually looking for during the scope. There are many reasons why someone would undergo one of these procedures. And let me be clear, I perform these procedures on patients of all ages, from age 17 to over 90 years old. So they are not just for people who are older. So let's take someone who I'm doing an upper endoscopy on for the super common symptom of abdominal bloating. The list of what could be causing someone to have bloating is very long. Constipation, lactose intolerance, Helicobacter pylori or H. pylori, celiac disease, gastroparesis, to name just a few. Some of these conditions can be diagnosed with an upper endoscopy and some cannot. This is what I look for when I perform an upper endoscopy. We first examine the esophagus. And here I'm looking for evidence of acid reflux or acid reflux-induced tissue damage called esophagitis. We also look for a hiatal hernia, which is very common. I will usually take biopsies in the middle of the esophagus to rule out something called eosinophilic esophagitis, a condition related to food allergies. While this condition doesn't usually cause bloating, just to be complete, I will usually biopsy here. I would also see a condition called Barrett's esophagus and esophageal varices, both of which are located in the lower part of the esophagus. Next, we examine the stomach. Here we are looking for several things. One is retained food, a sign of gastroparesis, ulcers, inflammation of the lining of the stomach called gastritis, or even a blockage. Regardless of any findings here, it is imperative for your doctor to take biopsies for a bacteria called Helicobacter pylori. This is of course microscopic, so it cannot be seen with the naked eye, and so to diagnose it during an upper endoscopy, biopsies have to be taken in the stomach. It's important that several biopsies be taken from both the bottom part of the stomach, called the gastric antrum, as well as the top of the stomach, called the gastric body. This is because the location of the bacteria within the stomach can be patchy, and so it can be missed if adequate biopsy specimens are not taken. Lastly, our upper endoscope can reach into the first several inches of the small intestine. And here we are looking for ulcers, which occur just as frequently in the duodenum as they do in the stomach, inflammation, called duodenitis, and features that can be seen in celiac disease, such as flattening of the folds of the duodenum, flattening of the villi or the finger-like projections of the duodenum, and something called cobblestoning. And just like with biopsies for H. pylori in the stomach, multiple biopsies need to be taken in different areas of the duodenum to make the diagnosis of celiac disease. Of course, anywhere along the way during the scope, we look for anything suspicious such as cancer. It takes careful examination and multiple biopsies to rule out all possible causes of a patient's symptoms. Hope this helps. Be well.